Widely and inaccurately believed to be just a really bad headache, migraine is an extraordinarily common neurological disease affecting 36 million men, women, and children in the United States, 26 million of which suffer attacks on a near daily basis. Migraines can last from 4 to 72 hours, and more than 90% of sufferers are unable to work or function normally when stricken. For many headache sufferers, this ongoing pain significantly diminishes their quality of life.
The migraine is what we call a disease of the brain. There's actually an abnormality in the circuitry of the brain. And clinically, what people see in a migraine, in addition to a terrible incapacitating headache, are the other symptoms that come with it. Commonly, people with migraines will have visual disturbances. They can have that numbness or tingling in different parts of the body. Some of our worst patients have hemiplegic migraines where they actually get paralyzed on a portion of their body. And the other hallmarks of the migraine are the triggers. Most people will have something that will set them off. It can be bright lights, it can be perfume, something they eat. So again, it all boils down to an absolutely incapacitating illness.
Board certified in interventional pain management and a headache specialist, Dr. Kenneth Reed has dedicated his life to helping people with migraines find a comfortable, narcotic-free solution to their chronic pain. In 2010, Dr. Reed founded Reed Migraine Centers in Dallas with a dedication to treating patients suffering from otherwise untreatable chronic migraine headaches.
Our mission is to control their migraines, restore their life with no or minimal medications. People don't really understand how dramatic the change is after our procedure. This is absolutely life-changing.
This is the Reed procedure, a permanent surgical migraine treatment for those suffering from incapacitating migraine headaches. This technique involves neurostimulation of the occipital and supraorbital nerves and has an over 80% success rate in patients of all ages.
It truly is minimally invasive, very safe. You can't see it, you can't feel it. When it is implanted, there are 4 very, very thin little plastic covered wires slipped under the skin. 1 above each eyebrow, and then there's 2 in the back of the head at the base, about where I'm putting here. These are thinner than an IV tube, and it's important to say they're not deep. They're under the skin, but they're outside the skull. They cannot hurt anything. And these little wires are passed under the skin to a very small battery, about the size of a pacemaker, that's slipped under the skin. You cannot see it, you cannot feel it, you don't even know it's there, except for the fact it's stopping your headaches. It's not unusual in the recovery room when we turn it on to have the patient start crying. It's the first time in years that their headaches have been gone. It's wonderfully gratifying to see our patients out fully engaged.
Dr. Reed and his partner physicians have performed over 1,000 neurostimulation implants for headaches and are world-recognized leaders in the field.
One of the main things I like about the stimulator procedures is you get to do a trial before we ever do the implant. I tell patients you can think of it as a test drive. We put in the temporary electrodes and they can really take it home and try it out for a few days and see if it helps their pain. The implant procedure, surgery takes about an hour and then they go home the same day. You can take somebody who's basically dropped out of life and do a procedure, and then you see them a few weeks or months later and it's like a totally different person.
For migraine sufferers who have failed to respond to pharmaceutical treatments, this innovative approach can achieve life-restoring results and get you back to work, school, or play pain-free.
I had very frequent migraines. At some point, they became intractable, so I had a 24/7 migraine every second of every minute of every day. That went on for about 7 years. We were going down every possible path, every nerve block, Botox, every possible medication anyone's ever heard of. Nothing was working, and I went to another neurologist for a 6th or 7th opinion, and she said, "You're kind of at the end of your rope. Why don't you try the Reed procedure?" During the night of the trial, we went home, and that night, at about 4 in the morning, I woke up and I felt like something was just completely wrong, and realized it was because I didn't have a migraine. It was just so incredible. I had the procedure on April 13th, 2012. I will never forget that date. The surgery is minimal, and the rewards are just so incredible. My life completely changed. Every second of my life has been different. I would recommend the Reed procedure to anybody who's suffered for a long time. It really can change your life.
I started getting migraines in my 20s. It affected my job. I couldn't take care of my patients. I couldn't go out and have a social life. I've never in my life been to a concert before. So that's when I hit bottom, when I couldn't do my job and I was having to leave work to go take care of my own self. Once the pain shifts from my left eye to my right eye, I start having neuro problems and I have speech problems that accompany it. I was on YouTube looking for videos to help calm my migraine down, anything from ASMR to specific types of music, and I came across Dr. Reed's migraine procedure videos, watched all of them, immediately sent him a consultation request and heard back within 2 days. I had my trial procedure last week, and then that following Thursday, I went into the office with Dr. Will, and he took the leads out and we discussed with his other associates what the next step would be. It's general anesthesia. After you wake up, you go into a small private room and talk with one of his associates, and she turns on the machine and I instantly felt results and my migraine went away. I instantly cried, and I don't typically cry. It was more of a shock to be in pain for so long and then it stopped. I would recommend the Reed migraine procedure because it gives you your life back. You live in so long in pain that this gives you an opportunity to be pain-free.
The greatest part of my job is watching when we put this in and turn it on. Some people smile and some people start crying. So I get to see every week of my life, somebody's life is being changed. It's wonderful.
Learn more today about Reed Migraine Centers. Control your headaches, restore your life. For more information or to schedule a consultation, visit reedmigraine.com or call 214-523-9629.